October the 24th, 2013, the International Conference on Telemedicine took place in Catania, in the main hall of the Bioscientific Pole of the University of Catania. The conference was organized in collaboration with Italian Society of Telemedicine and with Academia RES PUBLICA. Telemedicine is identified as a tool to make constitutional law effective. Professor Guglielmo Trovato, director of the Master in E-Learning and Telemedicine of the University of Catania, presented a lecture on e-learning and e-health. E-learning and telematic medicine and surgery are two complementary tools to guarantee the right to health and allow innovations, opportunities and obstacles. Telemedicine is the set of medical and informatics techniques that allow the care of a patient at distance, or more generally to provide health services at a distance. In the field of clinical diagnostics, it is possible for a doctor to make a diagnosis on a patient who is not physically present through the remote transmission of data produced by diagnostic tools. The second medical opinion is one of the most common applications in the field of telemedicine. It consists in providing a remote clinical opinion supported by acquired data sent to a remote doctor who analyzes and reports them, actually producing a second clinical evaluation on a patient. Telemedical techniques also promote distance learning applications, in which the remote physician can specialize doctors who ask for a second opinion on a clinical case through e-learning techniques. The first telemedicine experiments were conducted to allow adequate assistance in the most remote geographic areas or in difficult situations along navigations, offshore platforms, Arctic or space expeditions. Later, with the diffusion of more efficient data compression techniques and faster networks, it was also possible to send voluminous data via networks, such as images of a computerized tomography or even more complex radiological images. In Italy, one of the first telemedicine applications consisted of the experimental transmission of remote electrocardiograms, started in 1976, using normal telephone lines. Dr. Trovato collaborated with the activity carried out in Catania by the Hospital Cardiology of Professor Guglielmo with the Hospital of Lipari Islands. In Italy since 10 years, since 2002, the second-level Master in E-Learning applied to health sciences and telecommunication in medicine, supported by the Research Ministry and operating in 10 faculties of medicine, including Rome, Catania and Pisa. The purpose of high-level training of professionals in the field of health sciences, not just doctors, has also been implemented through technological and educational experimentation processes. There are barriers to the adoption of telemedicine, even in intensive care and emergency units. These are regulatory problems related to the difficulty and cost of obtaining authorizations, the protection of malpractice and the accreditation of several structures. The lack of acceptance and reimbursement by the government and commercial insurance creates an important financial barrier, which unloads the investment on the hospital or the health system. Cultural barriers are also related to the lack of knowledge, training, or willingness of some doctors towards clinical paradigms for telemedicine applications. Also, the excessive hopes of patients in health technologies may be a major problem and even a barrier. The other, more important, barriers are related to the futility of expensive approaches with few benefits, which has taken away the credit for this practice. Telemonitoring and home video surveillance, particularly of fragile patients, use various home robotic tools, with sometimes very important triggering and feedback. A list of application areas, not necessarily in conditions of limited resources or far geographical distances, includes telecardiology, teleradiology and teleultrasound, gastroenterological and urological teleendoscopy, teleobstetrics, telepedimology, telenursing, teletraumatology, telepsychiatry, telepharmacy, telerehabilitation, teleaudiology, teleophthalmology, teledentistry, telesurgery and robotic surgery. Thanks for the attention. See you soon.